Okay, let's try that again. If you can hear me, say hello. Let me know where you are coming in from. And let me know what is good in your world. Thank you so much for your patience. Sorry, it was a little bit weird coming on. And then just because I was out last week. So let me see, it never shows up. But we have some great, okay, now I can see me. And I know Sharon, if you're on, I'm going to tag you in this too. You know, Sharon had questions, and then there's Sharon. And then Susan, if you guys are on, say hello, and I will answer both of your questions. Okay, well, we're going to get rocking and rolling here. So today we are talking about the 3 signs of shoulder pain that you shouldn't ignore and how you can avoid surgery. And I got some really wonderful questions that I'm going to get to. Questions about and confusion around shoulder pain is something that I hear all the time. So what we're going to be talking about, I'm going to start. And again, I got some pictures and slide because I really think it helps make everything make sense and connect the dots. So we'll be going a little bit over like the shoulder anatomy, posture and mechanics and how that relates into shoulder pain, exercises. What is the one exercise that I see so many people get told what to do, done in exercise classes, and people do it wrong, and it can actually cause more harm than good. So we'll be talking to you about that. And then we got some specific questions around some exercise. Why are certain movements painful? Oh, hi, Dean. Nice to see you. Hello from Santa Monica. Hopefully you're enjoying like the almost 80-degree weather that we're getting in Southern California, which I'm not complaining about. And then I'm going to talk a little bit about frozen shoulder, which can sometimes be a side effect from a lot of different shoulder issues. And it's definitely something that you want to avoid, along with the very dreaded rotator cuff injuries and surgeries. Takes a long time to get over. My name is Dr. Yvonne Castillo. If you are new to me, new to this group, welcome, welcome, welcome. I'm a integrative pain specialist, doctor of physical therapy, and women's health coach. And I spent a majority of over a past decade kind of in the OR observing multitudes of orthopedic surgeries. And I literally would treat probably something around like 12 shoulder rotator cuffs in a day. I've seen this procedure done over, I've lost count, but many, many, many times. And it's so common, and there's a reason it's so common, but I don't want you to be one of those statistics. So let's get started. So I'm going to share my screen here, and then we'll go through a little bit of the anatomy because I think it's very helpful. I'm a visual person, and let me just minimize this. And I think it's helpful to see what the heck is going on with the shoulder, so you know how to avoid injuries and also what you can do to help make sure that you don't go down the route of rotator cuff tears and injuries. So, share my screen. Okay. Okay, so here we go. So you are, oops. Let's go back. So the shoulder muscles, and last week we talked about neck pain, and I alluded to the fact of how closely related the shoulder and the neck are together. And I've yet to, in my decades of working with people, ever met anybody that had a shoulder injury or a shoulder issue that there wasn't some underlying imbalance happening at the neck. And likewise, people having neck issues, neck limitations, where they didn't have some sort of shoulder imbalance going on. If this is you, I would love to know if you have neck issues, if you have shoulder issues, if you have some combination of both of those together, or maybe you've experienced like, oh, I tweaked or torqued my neck, and then, weeks or months later, all of a sudden this shoulder clicking started to come up, and things just weren't the same again. So when we are looking at the shoulder, so the shoulder itself is a floating joint. It isn't like your knee joint where it's all encased, or your hip joint in through there. It essentially is the only thing that holds your shoulder to your body is your clavicular joint right here. Other than that, it is the scapula, which you can see from the side. And then you have your clavicle that runs around. Hi, Sharon. Okay, you're so welcome. Both neck shoulders have been tight. Okay, so good to see you on, Sharon. Thank you for being patient coming on, and we're going to answer all your great questions that you had. So when you think of the body, anytime there's a lot of room for mobility in any of our joints, you're going to sacrifice stability. So you see that in the shoulder, we can do a lot of things. We have so much room for motion. Same thing with the hip. We have a lot of room for motion. So there's this trade-off of stability because there's not what technically people call a lot of joint congruency into there. It's not case the whole lot of ligaments, or the joint isn't kind of packed in together into there. So anytime we have a lot of movement, there's also room for air. And specifically with the shoulder, what gives the shoulder its stability and helps with the movement is the muscles. So and there's over 16 muscles that attach from the scapula to the body. And looking at this view, so on your left side, you'll see more of the superficial muscles, so meaning those top layer of muscles. And now what they've done is they've peeled away your trap into there. And we talked about this last week. We talked about shoulder pain, but looking at this trap that attaches to the base of the skull and then comes down, attaches to the spine of the scapula, and there attaches to all these cervical and thoracic vertebrae into there. So room for tug of war. And we won't get into like the crazy mechanics today of kind of the rhythm of the scapular movement, but it's something that definitely plays into neck issues and shoulder issues and why people will have imbalances. And I'll do a couple kind of movements and walk you guys through some things that you guys can kind of check on your own. So this was a muscle we talked about last week, the lovely levator scapula that attaches into your cervical vertebrae in through here, and then the spine of the scapula in through there. Its job is it can elevate the shoulder and then also helps with as the shoulder blades kind of gliding up, gliding down. These are other kind of hidden culprits, your rhomboids in here, your minor and your major. When a lot of people will complain about like burning in between the shoulder blades, this muscle tends to be the culprit in through there. And I have another picture that has your rotator cuff, but they've taken away your supraspinatus that sits on the top and your infraspinatus that hits on here. And this is a muscle that gets injured a lot because it passes through underneath the acromion and it tends to get impinged. And I'll show you why it tends to get impinged in through a little bit. So this is kind of a backside view. This is the serratus that attaches into there. And these are your triceps muscles into there. So the muscles that are kind of keeping your shoulder blade, so it doesn't just, if you've ever stood behind somebody and you see that their shoulder blade like wings off their back or is like really, really tilted off their back, it's because there tends to be an imbalance in the strength or in the stability of those muscles. Either some muscles are too short, they've been over lengthened. It could be because of a postural thing. People are really rounded forward. They're overstretching those muscles. More often what we tend to see, it tends to be those front side muscles, your pec muscles, that tends to tip the shoulder forward. And that's why if you've ever looked at somebody, people will have like the winging of the shoulder blade and can lead to like some clunking in through there. And then let's see on the next page. So this is now we're looking at your shoulder like from the front of it. So we looked at the back on the back side. And this is just showing some of the ligaments. Ligaments attach bone to bone. Tendons go from muscle to tendon and then they attach to bone. But these guys right in through here, your coracoacromial ligament, this is where your supraspinatus muscle passes through. And these are the ligaments that attach and encase kind of your arm bone, so your humerus into the clavicle. And it just sits right there. Most people call it kind of like almost like a ball and a T. It's like this big humeral head and this little bit of the scapula that it sits on. And that allows for all the motion into there. So that's the shoulder joint itself. We'll see that what happens when inflammation happens, when mechanics are off, why this ligament can be a problem, or not so much a problem, but the mechanics that lead to it. So this is, let me move me. And if you have any questions, just kind of pop them in. So now we're looking at, in the rotator cuff. So this is one that tends to be when people have, shoulder inflammation, shoulder, if you've ever heard of impingement. you know, and like I said, what are the 3 signs of shoulder pain that you shouldn't ignore? They tend to be something like catching, instability of the shoulder is a big one, and then also a referral pattern. In the body, sometimes the brain can kind of pinpoint like, oh, I have pain there, it's coming from right there. Rotator cuff, and then also another structure, which is your labrum. If you've ever heard of your labrum, if people like you tore your labrum, they get a Bankart repair. Your labrum is soft tissue that sits on the inside of the shoulder, and when you damage like inside, or it's not necessarily damaged or compromised or impinged or injured, the brain kind of reads like, oh, it's painful, and that's why referral pattern. The patterns that we'll tend to see of the rotator cuff can be like right in the front. People will get this pain that goes down the side of the shoulder, like a zinging pain. Labral tends to be in the back, where like people will feel like this, like gnawing, like almost someone's like driving a screwdriver in the back. And that's referral pain for stuff happening on the inside. People are like, oh, I just have to rub my deltoid, but it's like, it's actually coming from inside the joint. Having those types of pain are something that you want to pay attention to. Those kind of 3 things, the catching, like if you get like a clunking in through the shoulder, if you feel like something's snapping on the inside, those tend to be kind of the early stages of shoulder that can progress into something more significant, like rotator cuff tears, whether they're partial or full, or again, when people get a peeling away of the labrum, of that inside lining of that soft tissue. And that's where those injuries tend to progress towards like subluxations and dislocations. And I talked about that in an email when I shared a story about one of my clients who literally at one time had to get shoulder surgery on both shoulders because she had a rotator cuff on one and she dislocated the other, and they had to do that again. You definitely do not want to go down that route. So we're looking at the rotator cuff here. So on your left side is the posterior, so being the back side. Anterior always means the front side of you. And this muscle right here, this supraspinatus, this one tends to be the one that tends to get compromised the most and injured the most, as well as your infraspinatus. This is your teres minor anterior. These are the only 2 muscles that do external rotation, so this type of movement of your shoulder. Most of the muscles that we have, your big honking pec, all those muscles kind of pull us forward. We tend to be more flexion dominant and internally rotated dominant. So you can see that we just have these little itty bitty muscles to do this external rotation, but a lot more muscles that pull us forward. And because it passes right through in here, what happens is, and I'll go over a little bit of the mechanics of the shoulder, and I'll grab the skeleton in a little bit, but what happens, why people run into impingement and inflammation is the job of this supraspinatus muscle. When you look at its line of pull, if it kind of is sitting on, I'll just grab the skeleton in here if you can see it. So it runs right in through here, and its job is it's supposed to pull back the humeral head so it doesn't gravitate up like this. So its job is to pull it this way so the arm bone moves like that. But what happens is when this muscle gets weakened, it gets inflamed, it's not strong enough, it cannot pull it this way. So then what happens is that this bone then starts to jam up in through there. Another thing that happens posturally when people have more of that rounded posture in through there, that also increases the amount of how much that humeral head is kind of enclosed in through that space. And you can even test out with yourself, like if you're here and you've got your shoulder back and you got opening, you can lift your shoulders all the way up. But if you're kind of slouched forward here, you can only lift your arms up that far. And that's where the neck sometimes comes in. People start to overuse their shoulders. So that really rounded posture where either your shoulders are rounded in like this, or they're elevated up high, again, that will compromise how much space lives right in through here. And when you're there, each time you're reaching or leaving up, or if you're going to swim, or if you're cross-country skiing and you're here and you're doing this type of motion and you're golfing or doing things, that will aggravate that area into there. So when we think of posturally where we want to be in a place where the shoulders are nice and opened up and they're not rounded forward into there. Those type of things, that type of patterning will lead to compromise of this supraspinatus muscle. And I'll talk a little bit about, some of the activities that are, and again, Sharon, you asked about, okay, well, when people ask about lifting weights overhead, why do I get pain with that? What else can I do? Same thing of swimming sports into there. And I know that you mentioned, okay, go cross country skiing. Well, the act of doing this with your poles, like that, this type of motion, and again, that closes off the joint, that repetitive motion in through there, that can really be irritating to the shoulder, again, if there isn't that balance. And with the shoulders, and a lot of people, even when you and I'll show you a couple things that, you can take yourself through to see, oh, how am I performing there? It's one thing just to be like, oh yeah, okay, I get a muscle test when I go to, the physical therapist, or I check my range of motion. But with the shoulders, it's not like you're just doing, you're not just trimming the hedge and you do one trim and you're done. It's the repetitive motion at which we use our shoulders, and the kind of the compromising positions that we put them in, that tends to cause shoulder pain, shoulder inflammation, and breakdown of it. So not only when you are thinking of, having great posture and working on the strength, but also training yourself for endurance so that you can do things with great form over an extended period of time. And when people think of it, mostly they think of, just your shoulder muscles, but when it comes to it, it's actually your backside strength. So when we look at those muscles on the back, what are the muscles, that stable base that keep those shoulder blades grounded so they're not tilting or going all over the place? That's the missing piece I see a lot, where when people are, oh, I want to do stuff for my shoulders, and they're doing the band exercises, when really they should be working on that stable base, which tends to be your postural strengthening muscles, that mid upper back. That's so important. So that's your rotator cuff, and then we'll look at, I think I have. So shoulder bursitis is another one when we're thinking of inflammation in between every kind of where, you have muscles and bones and stuff like that. You have these little like squishy sacs, and what that helps for is it keeps like the friction down. Because if you just had muscle like across bone or tendons across bone, it would create a lot of friction. So you have these little kind of jelly sacs, and you have bursa all around your body. If you've ever heard of hip bursitis, or people get like IT band syndrome, and they get this like crazy egg swelling on the side, that tends to be an inflamed bursa. It's very, very common in the shoulder, because again, what happens is that humeral head gets jammed up and through there. So this little gel kind of sac, that bursa gets inflamed. Itis meaning inflammation. It will get inflamed in through there. The tricky thing is with the shoulder is they never really get a break. It's like whether you're sleeping on your side, it will irritate it. Even just sleeping in bed on your back, but you're all rounded forward, that will irritate it. I mean, I don't know if you could make it through the day without using your arms, even just doing the simple things. And most people are actually even surprised that it's not even like the heavy lifting that actually irritates the shoulder. It's really sometimes just like the seemingly easy things, but it's positionally putting in your shoulder in a position that is creating some impingement or irritation. And I'll go through, when I walk you through some of the exercises, like the positions that the shoulders don't like. And sometimes it's the simplest things of, having your thumb turned up, your thumb turned down, or reaching across, with the certain things that you do. So if you have any questions, pop them in, but we'll kind of keep going. So again, so you can see the bursitis is inflamed in through there. And when people will go in, sometimes if you've ever heard it, like they try to do something called a subacromial decompression, where they go in and they actually shave down this bone, they trim up the bursa in through there. You can see that sometimes, if you've ever had that procedure, if you heard of it, they call it a bursectomy. They take a piece of that out. So that's something. Okay, so this is good. So again, you can see the normal kind of in through here. There's plenty of space for the rotator cuff to live. This is your biceps tendon that kind of wraps and runs around, and the labrum that I was talking about. So your biceps comes around, attaches into this thing called your labrum. The biceps tendon is another thing that can get inflamed, and it tends to be in like the triad when people have issues. And you can see you can feel it if you kind of move your shoulder from side to side, and you can feel something kind of clicking into there. That's your tendon, the biceps tendon go up. But you can imagine you're rounded forward and you're slouched like this, or this area is really tight, that biceps can get inflamed as well. And here's just a picture of just the inflammation of the tendons into there. Another reason why when people have shoulder issues, when there is inflammation and it feels like it just takes forever for it to heal, it does. And the reason for that is there isn't a whole lot of blood supply that goes to the shoulder and specifically to the supraspinatus tendon, that tendon that is right into here, the tendons that are right into there. So what that means is with blood supply, that gives you the good nutrients. So those healing factors to help out, you know, to rebuild the tissue into there. So if you're not having a constant enough stream of these good nutrients to the area, it takes a really long time for it to heal. And the cascade that tends to happen, just like anything, it's painful, so you don't use it. And then there tends to be an atrophy of the muscle. And then the more that the muscle atrophies, it's not as strong to biomechanically allow you to kind of lift your shoulder up because this muscle is weak. So then we tend to see even more that humeral head starts to jam up into there. So that's kind of a vicious cycle that we tend to see where people will go through this cascade of, you know, pain, inflammation, you know, not using it, and then it atrophies even more, and then they try to use it again, and it just kind of keeps going and going and going. So that is that picture. Okay, partial and full rotator cuff tear. So another thing that can happen when that humeral head bounces up, or even just having kind of posture like this, and I mentioned this last week when we talked about bone spurs, but when bone contacts bone, it stimulates bone growth, the osteophytes to start to lay down bone. And what can happen, and if you've ever seen this on, you know, x-ray, you can kind of Google it, like bone spurs. But what happens is like there starts to be these like little like jagged areas and these little calcium deposits that tend to build up. And I always tell people it's literally like almost like if you've ever seen like the edge of a serrated knife, like that's what is like on the edge of these, your clavicle bone and your acromion into there. So you can imagine if you have now less space because there's even more bone growth going in through there. Now it's all jagged and you've got an inflamed area. It's like I tell people, it's a finite space. It is like you're going into a bridge, but the area, it wants this much area, but you don't have it. So it's all the swollen tissue. It can't go anywhere. It's in an enclosed space. So it just kind of makes it even worse. And that's why, you know, it feels like it can go on, you know, and it doesn't heal and it takes forever because it can't expand out. It is a, you know, like I said, it's like you're going through a set tunnel, but you've got a big train going through. So this is a partial tear where it's just showing that just a portion of the tendon is cut. It's not completely cut all the way through. How they go about diagnosing this, you can get it pretty good by just doing like a physical exam, whether or not people have it or not. But they'll look on MRI and X-ray. Sometimes you can say MRI is what you'll see a little bit more better with soft tissue. Sometimes they'll put dye in the area, and what they look for is if like the fluid seeks through, it's basically there's been a loss of broken of the barrier, and that's what they'll see the tear into there. And that was a question that I got from people. I was like, okay, what can I do if I have a partial tear to keep it going from a full rotator cuff tear? If I have a partial tear, does that mean I'm necessarily going to go and need a rotator cuff surgery? Not necessarily. And if you got my email, it spoke how basically a lot, like over 90% of people that do have cuff tears end up getting surgery. And it's because of the things that I spoke about, you know, the poor healing, poor blood supply happening, the postural stuff, people not addressing the kind of overall big picture, and they kind of stay stuck. The same thing too, people, you know, get serious if it's painful, they're not going to use it when the very thing that you should be doing is working on kind of the root cause factors that have kind of put you in a position to get the tear. And the big thing, like I always say, is doing the do's and not doing the don'ts. Like don't keep pissing off the shoulder, and doing activities that irritate it. And then also working on making sure that our body is opened up, that it's strong enough, and that we've got that kind of backside strength and support. Okay, and that's so we're going to talk about low back pain on Wednesday. I'm doing a bonus call for that, so I'm going to shave those. So that's kind of the mechanics that are going on there. I'm going to stop share, and then I'll kind of walk you guys through some stuff. Let me know, pop in if you have any questions, if you've seen this before, if this makes sense. Have you gone to physical therapy? You know, were you doing those band exercises and stuff like that? I would love to know. And then I'm going to kind of walk you through things. So we talked about the anatomy, talked about kind of the mechanics of the shoulder, postures and positions that tend to lead to rotator cuff tears. So, and this is something to kind of test out too on yourself if you can see me, but most people, and this is something, is they don't have kind of full external rotation. You should be able to have full external rotation there. And a lot of people, when I ask them, like, when I take my clients through a biomechanical assessment, when I work with my one-on-one clients, and if you watch my shoulder, they do something like this versus being able to have that spin. And you should be able to have it through that full arc of motion. This is something that if you go in front of a mirror and you watch yourself and you're like, okay, do I have full range of motion? And that can say a lot of different things of either muscles being imbalanced, being too tight in the pec, in the back. There could be some joint capsule tightness that tends to be tight. And same thing too, you should be able to, take your arms overhead like this. And one thing that is always a telltale sign, and most people don't pick up on this, but when they're lifting their arms up overhead, one thing that I see is people's arms kind of like spin out to the side and they do something like that versus being able to have it where it's dead on and they can do something like that. You tend to see they go up and then it kind of does this weird little like spin and it's off to the side. That tells me, there's some pec restriction into there. There's stuff going in the back, but each time they're going to lift their arms up, there's not enough space in that shoulder to clear that space. So it runs and it's creating impingement of inside of the shoulder and through there too. And it's leading to, again, the problems. Then I'll look at people from the backside and kind of look at what are their scapulas doing when they're lifting their arms up, when they're lifting them down. But you should be able to have that full external rotation as well as lifting those arms up overhead without doing these things. And you should from the side be able to have you're lifting your arms up. The other thing people do is they do this kind of upper back thoracic extension to get themselves straight. They can't be in alignment and get their arms overhead. That's why, again, people will have back issues with shoulder issues because they don't have range of motion of the shoulders, and they'll either try to pick it up in the neck, the mid thoracic area. Even a lot of times people will have a very stiffness. Again, if you see that kind of rounding posture, they tend to be really stiff and tight in that kind of mid-thoracic area. And because there's limitation of their spine, they can't lift their arms up over it. So again, if they're just, oh, I've got shoulder pain, I'm just going to Google some, band exercises or go do whatever, but nobody's addressing what's happening at your spine as a whole person, you'll just keep on chasing your tail. So again, that's why it's always so important to get to the root cause, but to look at everything as a whole and not just in isolation. When you go to the therapist and they'll take you, okay, just do this muscle test and that muscle test. Okay, you're this grade, you're that grade, you're 4, you're 5, but it doesn't really look at mechanically the demand that you're putting on your body and how you perform biomechanically. And I'm going to get to a couple questions that you guys had specifically. So when we're thinking of the gap of like, why do I still have shoulder pain? Why can I not still, lift up something heavy overhead or go cross-country skiing or carry a backpack and stuff? It's all those things, doing those repetitive motions. Why can't I go swimming? Why can't I ride a bike and stuff like that? You need to look at the bigger picture of things. And then I wanted to highlight real quick about frozen shoulder. So frozen shoulder is when there is excessive inflammation. There's an autoimmune component too, where your body kind of hyperreacts to the inflammation of the shoulder. Typically tends to be there's, some sort of a trauma. And when we think of trauma, it's not like necessarily getting in an accident, although, falls or things like that can tip it off. Even something like going in for surgery or having a surgical procedure can then actually kick off excessive inflammation in frozen shoulder. Why am I talking to you about this? Because frozen shoulders are right up there with the rotator cuff surgeries, where it's incredibly debilitating and it's excruciatingly painful, and it's different across the board. But it can, some people, I've worked with clients where they're like, they couldn't even like lift their arm up off their body because it's literally glued to them. Because what happens is the capsule gets super inflamed. It creates this excessive amount of scar tissue. I always describe it as if like, if you've ever gone to the fair and you've like seen those cotton candy machines and they like spin around, like imagine if someone never turned off that cotton candy machine and you see all that like cotton candy and fiber, like, and I've seen that because they do a procedure where they go in and they scope it out. Like I've seen what that looks like, and that's what it looks like on the inside. It's like these sticky spider webs, red and super inflamed inside. And it's basically that joint capsule has gone inflamed. It's laid down excessive amount of scar tissue. It's very, very common with women, especially women over 40. There's a hormonal component to it. So this is just an FYI to basically light the fire, hopefully under your butt, that if you have these little twinges, if you have these little catches, if you're starting to notice a loss of range of motion, that you can't, put on your jacket anymore, carry a purse on one side, lift things up overhead, get the glasses up overhead, load the dishwasher, doing those types of things. Shoulder pain, shoulder injuries, catching, clicking, all that stuff, not being able to sleep on your side. It's not something that you just want to sweep under the carpet, because it's one of those things, just like everything, the sooner that you deal with it, the better, because it is one of those things where it can really start to accelerate. And then you start to get to the point where you're starting to back yourself into a corner where you are going to have to go down the surgery route. But to know that there's many things that you can do, even if you may have, you do have a partial tear, there is some level of instability. There's so much that you can do. So again, if this is making sense, or if you have any questions, just pop them on in. And okay, so now we're going to answer some other questions. So when it comes to the shoulder, like I said, when it is, you're rounded like that, you're up like that, that doesn't create a whole lot of space in the shoulder. So any kind of overhead movement tends to just kind of jam the shoulder up and through there. What the shoulder doesn't like too, as you're kind of lifting the shoulder up overhead, what happens is it kind of creates space, and then there's less space, right? When you kind of get to like shoulder level, that's the least amount of space for the humeral head to be right into the acromion space. So as you lift up, it gets smaller and smaller, and then it gets a little bit bigger as it goes up and through there. So that's why when people will have what they call like a painful arc of motion, where it's like, I'm okay, then it's painful, 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 and then it clears, and then it's like not so painful again. And that just has to do with the space that's in there. So when people are going to exercise classes, and I even have my weights here, and they're like, all the time, shoulder presses overhead, yay, yay, yay. That tends to create a lot of problems. And I'm a Pilates instructor, a bar instructor. I've taught multiple classes, but even when I'm like a person in the class, I'm absolutely horrified by what people are doing. Mistakes that people make is they lift weights that are too heavy. So again, heavy isn't always better. And I'll tell you a couple exercises that, tend to create. So anything overhead, when you have shoulder pain, you do not have to go overhead. You can stay at, slightly below shoulder level. You want to use an appropriate weight. And even as you're doing more reps, you may be getting tired, put the weights down. The shoulder does not like, again, when it's up above shoulder height, that can create, if you've already got shoulder issues, more shoulder issues. Another thing too is when you're thumbs up versus thumbs down. This kind of turning down closes off that space. It makes that space smaller. So again, when people are doing like thumb down, cans in through there, or when they're, doing these kind of upward rows and like that, those are all big no's. Even things like when you're like, loading a dishwasher, you're pulling things, like that's why that's painful. Even when people are like pulling up their pants and doing stuff, or taking off their clothes, putting a sports bra, like that's why it's painful. You want to, as much as you possibly can, stop doing all those things that are irritating your shoulder for a period of time. Another, big one too that I see is like when people are doing tricep works, and it comes down to form where they're here and they're all like this, and they're doing this, and they're way too heavy with their weights, and they're pushing stuff versus giving themselves air. They may just have to lean forward, having better posture and better mechanics and doing it that way. Same thing, your tricep dips, big nose. And again, when people, I know Sharon, you asked about, planks and push-ups, that may be something that you're going to have to modify for a time, going up against a wall, maybe being on your forearms. But so many people are already rounded forward here, and they don't even have the strength to do that, and they're just impinging themselves even more. So that's why those tend to be painful. Those positions tend to be painful. Even something like I said, the one exercise you hear all the time, drives me absolutely crazy. It's like the worst cue ever is, people think, posture exercises. I need to squeeze my shoulder blades together, squeeze my shoulder blades together. And it's like the worst cue ever, because it actually creates more issues on your front, and you're training yourself. And when people tend to do it, they tend to squeeze their shoulder blades, get their necks in, and it's really not doing anything. You're not really strengthening your shoulders the way it needs to in that back side of the body. When I cue people, when we're doing stuff, you want to think like you're almost like stretching a band from like clavicle to clavicle, like almost like if you had a measuring tape, you want to grow across, and it really should just be a slide of the shoulder blades in your back pocket. When you look at the anatomy, you look at the muscles, that's what the jobs, the lats and the traps are to do. It's in this kind of downward position, but all the time when people are, doing, squeeze pinch your shoulder blades together. Now lift your arms up. It's like you're already closing off that area, and you're building poor mechanics of your backside of your body and your shoulders at general. So let me know. I would love to know if you have heard that before, but that's something that totally just makes me go crazy. Stop squeezing your shoulder blades. You do not have a pencil between your shoulder blades that you need to squeeze together. That will create issues for your shoulders. And then, that's sharing you. I know. So when it makes so much sense, like when you said, when you got your cross country pulls and you're having to do this motion and through there, this type of emotion, especially if you're sticking something in the ground and having to pull yourself going forward, that type of thing can create a lot of stress on the shoulder and cause that irritation. And I somewhat know your body. So that's where it's like going back to the basics and making sure that, again, you're opening up your shoulder, looking at kind of upper body mobility, not being hunched over on that. And again, because it's a repetitive motion and it requires a lot of strength, that's where doing the strengthening work, making your back sure that your, mid upper back is nice and strong, and also doing, again, and I talk about my kind of 3 phases, making sure you do the soft and the stretch and the strengthening. So making sure that you take that straight jacket off of the tight pec, tight neck muscles, tight pec minor, mid upper back muscles, making sure everything's nice and opened up, making sure that you're, doing and you've got good full range of motion of your shoulder joint. And then again, making sure that you're strong, not just strong, and again, strong in, again, people just think strength, I think, in very like one-dimensionally in there, but strength is power, it's endurance, and it's stamina. And the latter two, the breakdown of the latter two are when, especially when it comes to shoulders, why people run into pain, because they can't withstand, either holding their arm up for a period of time, like I said, like trimming a hedge, like having you hold your arm up, hold something up for a period of time, or just doing a repetitive motion, like something like cross-country skiing, sticking those poles in, or swimming for a period of time, or pushing themselves up, or, lifting weights as they're going through an exercise class. So I hope that makes sense. Let me know if you have any questions on there. So I'll recap real quick and let me know if you have any questions. Oh, and another thing too, and people, and this is again why, positioning of the shoulder. So people will always default, and I'm going to talk about this on Wednesday when we talk about low back pain and yoga. It's people like, oh, they always do like, oh yeah, yoga's super light, like yoga's super great. But the one thing, and this has happened to more people that go through like yoga teacher trainings or things like that, but the downward dog kind of motion, that right there it's also weight bearing, but that can impinge the shoulders quite a bit. Going through a chaturanga, like this type of emotion, lowering yourself, very few people actually have the mobility of their shoulders and the strength of the shoulders to do that. And again, because people have to do it repetitively over and over and over again, it can create some shoulder issues. So be mindful of that. I'm not saying like yoga is like the worst thing in the world and you should never do it. But again, knowing your body, form always comes first. Listening to your body, doing the modifications as need be. But it really is, when it comes to the shoulder, it's kind of like a princess. It wants to be in that perfect spot. And when it doesn't have the space and it doesn't have the strength to allow for the motion and to sustain the activities that you need to do, that's where you run into issues. And again, if you get anything from my talk today, it's don't ignore shoulder pain. Don't ignore catching and clicking and instability, or that dead arm that you get, or, those pains that shoot down your arm, not being able to sleep on your side, not being able to put on a tight jacket or reach into your back pocket, all those things, because it really does, it builds on itself. And then that's where, and this is so classic, I get people go to get the luggage out of, during their Hawaii vacation, and they hear the like of their shoulder, or and this is something, don't do this when you travel, but like lifting up the luggage and it catches on something, and that type of motion that goes, or they go in and get a massage and the massage therapist puts their arm behind the back, and then that's the final thing, that's the final straw that just kind of really compromises the shoulder and can either lead to a very serious injury. So again, so today we talked about the anatomy of the shoulder, the biomechanics of the shoulder, how the importance of posture and the mechanics of the shoulder is, and why when any of those are compromised or those imbalanced, it can lead to shoulder issues. Check out your range of motion and seeing how are you lifting your shoulders up? Does it kind of twist towards the side? Do you have full range of external rotation? And then I talked about frozen shoulder, talked about rotator cuff and what you can do, and the certain positions and exercises that you want to be mindful of and avoid, modify, and then know that you're in charge, and there's absolutely no shame if you have to go down in weight when you're doing upper body weight. If you have to drop the weights at any point in time, or if you're not going into a full plank and you're doing it up against a wall, or you're making modifications, those things are all great, and they don't have to be a permanent thing until your body's kind of playing catch up in through there. So I hope that was helpful. If you are listening back, give me a hashtag replay. And if you have any questions, go ahead and just pop your questions in, and I'll be happy to come back and answer them. On Wednesday, I'll be talking about low back pain. We got a couple really great questions that people were emailing or were posting in the group specifically about low back pain, arthritis, degenerative disc disease, and stenosis. So I wanted to make sure that I answered those. So I'm going to come back on Wednesday and answer those. And then on Thursday, we're going to be kicking off a 4-part inflammation series. So we're going to do kind of a bird's eye view on Thursday and kind of really talk about what the heck inflammation is, how does it play into, pain, limitations, fatigue, all that kind of stuff that you want to avoid. So we'll be talking about that on Thursday, and then I'll kind of give you guys a breakdown of what you can expect for the next kind of 4 days of the series, and keep a lookout on some emails that I'll be sending you. I have some questions and surveys because we're going to be doing the masterclass series again in April. So I want to get your feedback if there's any particular topic that you want me to dive into, any particular experts or speakers that you want me to get in and interview. It's going to be really fun. I'm super excited. We had so much fun doing that last time, and I can't wait to do it again. And again, if you have any shoulder issues or injuries, and you haven't been able to get anywhere, you've kind of done multiple things and you're worried about going down the route of surgery, pop your questions in, shoot me a DM again too, if you want to have a more personal conversation, and I can kind of share with you. And we can jump on a strategy call to kind of see what the heck is going on, and then what are your best next steps going forward so your shoulders don't have to slow you down. So thank you so much for being, yes, Sharon, it's going to be 5 p.m. So 5 p.m. Pacific Standard Time on Wednesday, and then we'll be back 5 p.m. on Thursday, and it's going to be really good. I'm so excited about the inflammation series. I mapped it all out. And there'll be, again, same thing too. I'll be bringing in visuals. There'll be checklists, and I got some recipes for you guys. It's going to be really great because I think inflammation is just kind of this airy-fairy thing that people think, oh, you got inflammation. Inflammation serves a purpose, just like pain and stress does, but it's when it's uncontrolled, unmanaged, and it creates all these other imbalances that we run into problems. And it really can be the limiting thing to kind of get out of that stuck place of constantly getting injured. Or the big thing is just like, people are like, I get this all the time when I'm working with clients, is they just don't feel like they're recovering as quickly as they should, or they do. And they don't want to be doing it where like, they want to be like hiking. And I know this is you, Sharon, they want to be hiking all day, and then when they want to go biking, they don't want to have to be like, oh, I can only hike one day and then I can't do back-to-back days, or I can't do, 3 things in one day. It's like, I mean, that's my life. That's what I want to be doing. I want to be able to do everything that I want to do in the volume that I want to do it, and not be like, oh, like I traveled, I sat in the car, and now I can't hike as long. So it's like, we want to make sure that recovery is as efficient as possible. And actually your ability, as I call it, the bounce back factor, but your ability to bounce back from activities is probably the best indicator, probably really how healthy you are. And so that's something that we're going to get over, and I'm going to help guide you guys to do the things that will help you speed up your recovery with doing anything. And sometimes that's not even the doing. Sometimes it's just sitting in front of the desk all day. Like, how can you recover from that quicker so you can go to the fun stuff? So we're going to be talking about all that next week. So I'm really excited. I'll be popping some questions into the group. And again, please give me your feedback if there's anything that you want me to mention or zero in on. Sharon, Sharon, and I think Susan, a couple other people gave me some great questions for this week. So please pop your questions and let's have a great conversation around this so that you guys can enjoy all the joys that are our life. So have a beautiful evening, and I will see you guys on Wednesday at 5 p.m. We'll be talking about low back pain, and then Thursday, 5 p.m. Pacific Standard Time, and we'll be talking about inflammation. All right, have a beautiful night, and I will see you guys all soon. Okay, take care. Bye.